Good day, everyone, especially to our instructor, Mrs. Luida Labis. Good day, Mom. So, before I start my report, I will introduce myself to all of you. I'm Gisa Arnigo. Hello. Me and my classmates will discuss about the common poultry diseases, preventions, and control. Diseases is the common problem in livestock farm, but as we observed, not only livestock was affected, but also plant. So first, I will discuss the bacterial diseases and infections. Bacterial infections of chicken remained a major problem both as a cause of ill health for commercial and backyard chicken productions, and as a chicken is one of the main carriers of Salmonella and Campylobacter, the most common causes of foodborne bacterial infections through meat and eggs. When we say Salmonella, it is a genus of brood sheep gram-negative bacteria of the family Enterobacteriaceae, while Campylobacter shedding by poultry varies by season, being highest in summer and autumn month. Campylobacteriusis is an infection caused by bacteria of a genus Campylobacter. These bacteria live in the intestines of healthy birds and raw poultry. Meat common has a Campylobacter on it. Unlike some viral infections, bacterial diseases of chickens is not usually associated with a high moral outbreaks about usually with endemic diseases that can lead to mortality, morbidity, and loss of productivity. When we say mortality, is it is mean a loss in income to broiler farms as well as to the hatcheries presence of diseases, feed storage, predators and bad weather conditions, extreme weather conditions were identified as a major causes of chicken mortality. While the morbidity refers to have a disease or a symptoms of disease. And lastly, it is a loss of productivity. As well as the scientific agents detailed here, many bacterial species may act as secondary infections. The viral or parasitic diseases. Treatment and control of bacterial diseases has relied on the use of antimicrobial or antibiotic drugs as a therapeutic, prophylactic, and growth promoting used. The risk of the risk in antimicrobial resistant or EMR is a considerable problems and need us to address how to antimicrobial are used in the poultry productions. The risk of EMR means that care and considerations is needed in the use of antimicrobials and that other control measures including the improvement to hygiene and biosecurity. The use of vaccine and live therapeutics such as probiotic bacteria will play a more important part. So let's proceed to diseases. First is the fall typhoid or Salmonella gallinarium or gallinarum. This kind of diseases is primarily for chicken. The pathogens is the negative bacterial root or gram-negative bacteria cause the infections including the pneumonia, bloodstream infections, one or surgical site infections, and meningitis. In healthcare setting, gram-negative bacteria are resistant to multiple drugs and are increasingly resistant to most available antibiotics. So next pathogens is facultative anaerobe. Facultative anaerobes are bacteria that can grow in both the presence or absence of oxygen. In addition, the oxygen concentrations, the oxygen reductions potentials of the growth medium influence the bacterial growth. The oxygen reductions potential is a relative measures of oxidizing or reducing capacity. Next of pathogens of the fall typhoid is the avians adapted serovar or Salmonella enterica, now rare in the Europe and North America. And lastly is the 09 serotype, no flagella. That's for the that's for the pathogens of the fall typhoid. So next is the clinical side. First is the Acute high mortality infection. Diarrhea frequently bloody at later stage of infections. Next is the inflammations of liver and spleen, hepatosplenomegaly. Next is the white spot lesions of liver and spleen with bruising of liver on exposures to air. Next is the persistent carriers may not show the symptoms. How is full typhoid contact in the poultry? Within a flock, full typhoid is spread by the bird-to-bird contact as well as through canning through cannibalisms of infected carcasses, bone contaminations, and fecal contamination of feeds, water, and litter. In addition, the bacteria can spread to chicks and the eggs as when eggs come from the contaminated hatchery. So that's for the clinical signs of the fall typhoid. So let's proceed to the transmissions epidemiology. First is the bird-to-bird transmissions via faces. Fall typhoid is spread by the bird-to-bird contact as well as through cannibalisms of infected carcasses, wound contaminations, and fetal contaminations of feeds, water, and litter. In addition, the bacteria can spread to chicks and the eggs as when eggs come from the contaminated hatcheries. Next is the vertical transmissions to chicks. Vertical transmissions is the passage of disease-causing agent or pathogen from a mother to baby during the period immediately before and after birth. Transmissions might occur across the placenta in the breast milk or through the direct contact during or after birth. Next is the zoonotic risky. Next is the low risky diagnosis, and lastly is the culture. Oh, di pa dahil last. Diagnosis, culture, pieces, or post-mortem materials on selected media. Examples, the brilliant green, XLD, agar. So next is the low numbers can be detected by enrichment culture, selenite, or RV media. Next is the serology, ELISA slide. Agglomerations can detect exposures and carriers. How to control how to control um the whole typhoid. The first is the vaccinations, good hygiene and biosecurity. Culling of infected birds is recommended. Both diseases can be controlled and eradicated by the use of serological testing and eliminations of positive bird. Vaccine may use to control the disease and antibiotics for the treatment of FT and PD. So let's proceed to the next diseases. Next is the porolum diseases. Salmonella polorum is an infectious poultry disease caused by the bacterium Salmonella polorum. The disease affects mainly young chicks and poults, but can also affect older chickens. As you see to the pictures, that is the polorum diseases. So let's tackle about the pathogens. The pathogens of these diseases is same from the first disease, which is the fall typhoid. First is the gram-negative bacterial root. So these bacteria have built-in abilities to find new ways to be resistant and can pass along genetic materials that allow other bacteria that can become a drug resistance as well. Next is the facultative anaerobe. Next is the avian's adapted serovar or Salmonella enterica, now rare in Europe and North America. Next is serotype no flagella. Serotype are a group within a single species or microorganisms such as bacteria or viruses, which shares of distinctive surface structure. Let's proceed to the clinical sign. So this will be the clinical signs of polorum diseases. Let's see if this clinical sign is the same from the first diseases. The first of clinical signs of polorum diseases is acute high mortality, infections of chicks. white diarrhea, inflammations of livers and spleen, hepatosplenomegaly, with a small white spot lesions, frequently persistent carriers that may not show symptoms. Next, let's proceed to transmissions epidemiology. First is frequent vertical transmission to chicks, bird-to-bird transmission via faces, and zonic risky, low risky. Villorum disease is spread from infected parent's bird via the eggs of the chicks. Infected chicks spread the diseases literally in the hatchery. So let's proceed to diagnosis. Culture of faces or post-mortem materials on selected media. Example, the brilliant green XLT agar. Low numbers can be detected by enrichment culture, selenite RV media. Next is cellulogy ELISA slide agglutinations, can detect exposures and carriers. How to control this kind of disease? Vaccinations, good hygiene and biosecurity, culling and infected birds is recommended. So vaccinations is the important to prevent this kind of diseases. Next is the salmonellosis, Salmonella enterica. The pathogens of these diseases is gram-negative bacteria root, facultative anaerobe, around 2,500 serotypes of Salmonella enterica can infect a warm-blooded animals, including birds. Next is most frequent serovars are Typhimurium and Enteritidis. So next is the clinical sign. The clinical sign of Salmonella is first is intestinal carriage, courage, courage is usually without a clinical sign. Next is dependent of serotype and isolate may cause transient diarrhea or septic infections. Next is hatchery infections can lead to high mortality outbreaks. So let's proceed to the topic of transmissions of epidemiology of this disease. So this will be the transmissions, bird to bird transmissions via faces, vertical transmission to chicks either via transovariant infections, is enteritidis or via. The major foodborne zoonotic pathogens associated with eggs is enteritidis and poultry meat. So diagnosis of this disease or bacteria which culture of faces or post-mortem materials on selective media. Low numbers can be selected by enrichment culture, selenite or RB media. Serology, ELISA slide agglutinations, candidates exposures and carriers. To control this kind of diseases and bacteria, let's have a vaccinations of breeders and layers, live attenuated, attenuative, mainly drinking waters, and inactivated injectable vaccine. Good hygiene and biosecurity usually. Routine, routine surveillance of flocks is practiced in some countries such as within the AU. So next is the Campylobacter. Campylobacter is usually occurring in the environment and lives in the guts of many animals including chickens. So Campylobacter has a wide distribution in wild bird. Owing to their great mobility, wild living birds may spread Campylobacter to poultry through fecal contaminations of the environment, feeds, and surface water. The pathogens of these bacterial diseases is highly motile, gram-negative spiral root with gull wings appearance. Next is the slight thermophile or 41 degrees Celsius and microwave microphile low oxygen. Our main species associated with poultry is Campylobacter jejuni. Last is low infection dose. The most common clinical symptoms of Campylobacter infections include the diarrhea, frequently bloody, abdominal pain, fever, headache, nausea, and or vomiting. The symptoms typically last for 3 to 6 days. So, clinical sign is often not carried without apparent disease. May cause mild to moderate transient diarrhea. Invasive infections may associated with byronic hepatitis with spotted lesions on the liver. Transmissions of these bacterial diseases is rapid spread from bird to bird via feces. Can be carried by wild birds and and vermin of transferred on boots, clothing, and toes. Zonic risk. Most common cause of foodborne bacteria infections with poultry meat main source. High level of contaminations in commercial poultry productions. Diagnosis. Cult- um, Culture on selective media under microphilics conditions, approximately 10% to 2, using cabinet or gas jar. Next is the blood-free media includes the charcoal, cipoperazone, deox, dioxide cholate, dioxide cholate, agar, or CCDE. Next is media with blood such as Iscaros agar or Columbia blood agar. Confirmation based on the morphology and gram stain. So let's proceed to the control. No vaccines available for this. No vaccine for available. Good biosecurity and hygiene can reduce transmissions. So I think that's all for my report.